Penetrating and perforating injuries. Effects of penetrating and perforating injuries on the globe include mechanical effects or lacerations, sympathetic ophthalmia, intraocular foreign bodies, and infection. Mechanical effects or lacerations. Effects of perforating injuries to the cornea. Iris prolapse, iris ischemic necrosis, sympathetic ophthalmia, and endophthalmitis. Sympathetic ophthalmia is bilateral diffuse granulomatous panuveitis. It occurs as a result of penetrating ocular trauma with uveal prolapse in less than 1%. It may also follow intraocular surgery in 0.01%. It occurs within 2 to 12 weeks in 65% of cases, whereas in 90% of cases it occurs within the first year up to 42 years. In sympathetic ophthalmia, their immune system is sensitized to uveal melanin, retinal protein S or soluble antigen, photoreceptor degradation product. It occurs in HLA DR4 positive individuals. There is diffuse granulomatous panuveitis sparing choriocapillaris. Dallen-Fuchs nodules, lymphocytes, eosinophils, epithelioid, giant cells, histiocytes, and pigment epithelial cells deposit on Bruch's membrane. The exciting eye shows an evidence of trauma. The sympathizing and the exciting eye show cells in anterior vitreous, matin fat keratic precipitates, iris thickening, Cope nodules, vitreous haze, Dallen-Fuchs nodules, which are small yellowish deep nodules. There is also optic neuritis or neuroretinitis and diffuse choroidal thickening. Sympathetic ophthalmia may be complicated by cataract, glaucoma, cystoid macular edema, and serous retinal detachment. The fluorescein angiography shows multiple pinpoint hyperfluorescence, pooling of dye in serous retinal detachment, and late disc staining. Differential diagnosis of sympathetic ophthalmia. Roth-Koyanagi-Harada syndrome, bilateral diffuse melanocytic proliferation, sarcoidosis, acute multifocal placoid pigment epitheliopathy, systemic lupus erythematosus choroidopathy, bullous central serous chorioretinopathy, uveal effusion syndrome, posterior scleritis, multiple evanescent white dot syndrome, Lyme borreliosis, and intraocular lymphoma. Intraocular foreign body. Effects of intraocular foreign body include mechanical injury, infection, sympathetic ophthalmia, or a chemical effect like siderosis or calcosis. Siderosis bulbi. Iron ionizes into ferrous and ferric iron oxide, inducing tissue staining. It enters epithelial cells of the iris and ciliary body, the lens, inducing posterior subcapsular cataract, the trabecular meshwork causing secondary glaucoma, the retina causing pseudo-retinitis pigmentosa-like picture, the optic nerve causing optic nerve atrophy. It may also cause iris muscles atrophy. The iron stains with Prussian blue. Calcosis oculi. Copper ionizes in the eye into copper oxide. Copper oxide is deposited in ocular tissue basement membrane formed of collagen. It deposits in the lens, anterior and posterior capsule, inducing a sunflower cataract, and in the corneal decimus membrane, causing Kayser-Fleischer rings. Chemical trauma. Alkali burn. The alkali burn is caused by lye burn, and it has various effects on the eye. It desquamates surface epithelium, penetrates into deep stroma, coagulates conjunctival vessels, giving a porcelain white appearance of conjunctiva, and is lethal to corneal keratocytes, endothelium, and lens epithelial cells, inducing a severe granulomatous iridocyclitis. In alkali burn, the healing phase takes the first few weeks, where collagenase enzyme activates mainly from corneal epithelium, keratocytes, and neutrophils. Corneal collagenase activity may induce corneal melting. Extensive fibrosis results in symblepharon, entropion, and severe dry eye. Acid burns. Acid burns may be caused by car batteries explosion. Acid has a limited ability to penetrate the eye, as it induces instant coagulative necrosis and surface protein precipitation. The tear film can neutralize acids with pH more than 3. The acid induces coagulative necrosis of corneal and conjunctival epithelium. Shedding of the epithelium results in corneal ulcer formation and subsequent healing.